Morning guys. Welcome back to our channel. Today we have a patient who is suffering from class 5A baldness. What are the required grafts in class 5A baldness, and what are the plans we made to this patient, and how is the results we achieved? That's what we are going to discuss in this video. Kindly watch the video until end. This gentleman approached us with class 5A baldness, having a family history, and almost most of the hairs has been fallen, and that's the reason we decided to go with the hair transplantation. Another reason is the age is around 28, 29 years, and backside donor is a very beautiful and very good thick density. So these are the few reasons we selected for doing the transplantation FUE method. Usually class 5A baldness patients, usually 18,000 to 20,000 hair follicle must have been lost. Approximately 18 to 20,000 follicular units must have been lost. Now, when we plan it, the required grafts supposed to be somewhere 5,000 to 6,000 grafts or follicular units. Achieving 6,000 grafts in a single session probably may not be possible in all the patients, and almost it's unlikely. This patient, we plan such a way that front mid scalp with more density, which is given a beautiful coverage in one session only. So that's what this patient highlights are. Usually, class 5A baldness requires 5 to 6,000 follicular units or grafts. But this numbers varies to person because of the size of the scalp. The scalp dimensions are very big. You would need more grafts. This is a medium-sized scalp, and that's one advantage. We did this patient almost 3,580 grafts, and that's the we could achieve in one session, one day. So here we divided his baldness into three parts: frontal scalp, mid scalp, and backside crown area. Overall baldness, if you can take it front to end, we have implanted more than 75 to 80% of the area with the 3,580 grafts. That's gave him beautiful look because of the nature of the hair, as well as the technique what we used with acute angle implantation made him very beautiful blending. That is the best nice camouflaging, and we all know that not only number of the grafts, it's kind of the angulations you are going to make it to the scalp, and orientation of the grafts, the way we want to implant and design the hairline, all this makes beautiful camouflage. Simply the number of the grafts doesn't make any sense all the times. That's what we did and planned to this patient. So I'm sure this kind of patient, class 5A baldness, would need second session also. But there are two things. We can make plans such a way that second session is optional. So there are two things we can make. Number one is implanting only in the front, and next time implanting only in the back. That is the first option. But second option is we made it such a way that we implanted around 70 to 75% of the area in the first session only, which makes a patient's second session would be optional. That's the plan we need to do for most of the patients, because and they would if they want, they can go for second session. If not, they can still wait for a couple of more years and still do the transplantation. That's the idea of making a smart plan in class 5A baldness. That's what we achieved best density in this patient. So what is the conclusion in this patient is most of the patients already have idea about a number of the grafts that they would need because of the internet knowledge, and they do their own research. Here, most of the guys will ask me, why to plan second session after 6 months or 8 months? Why can't we do next day? Maybe most of the clinics are offering me this way. Why can't you do? Guys, the point is we cannot harvest certain amount of grafts in single day and single session, because if you harvest all the grafts, imagine per given square centimeter you got some 30-40 hair. If you harvest all the grafts at one moment, one time, backside becomes so bad and backside you become bald. So we need to harvest only 2 3 out of 10 grafts and make it available for next session. That is the reason we can plan one session with the maximum safe donor limit and then wait for the results. After, once you get the results, what kind of density patient wanted it, we can re-implant it, or if you want to redesign the hairline, we can still do that. These are the options patient and surgeon will get to correct it in second session. If you do next day itself by harvesting all the grafts, of course, all the grafts can be harvestable in single day. Once you implant these grafts 6,000, 7,000 in the scalp, suppose that is the end for you. Nowhere, no other correction is possible for a doctor and the patient after a couple of years later. That is the reason one should always harvest within the safe donor limit. This safe donor limit only a doctor can able to tell you that day on the table. You'll check and decide. And second session must be minimum gap of 6 months or maximum of anytime, like 1 year, 2 years or later. Whereas someone want to go with a beard, probably they can do second session next day itself. This will make a different video on this, but well, this patient we have achieved a beautiful density and style with one session by planning a little smarter way, that implanting in the mid scalp and frontal area. So that is the reason with one session it would cover very well. So we achieved all these results after 10 months by doing one session of FUE single day. Thanks for watching. Keep watching for more updates.